Hello, I'm Dr. Jyoti Bajpai. I'm a professor of medical oncology in Tata Memorial Center, Mumbai, India. I'm also chair for Women for Oncology India as well as SAARC Federation of Oncology and core committee member for European Society of Medical and Pediatric Oncology. My leadership journey project involves exploration of gender climate in oncology in South Asian Association for Regional Cooperation in countries. As we know that women in medical workforce outnumbers to men oncologists. However, as far as the leadership positions are concerned, they lag behind. We have done a national survey in India, and wherein we found that again that women in leadership positions are much less. These findings were alarming. We also found that COVID-19 pandemic also affected women leaders much more than the men, and this was true for India as far as Europe is concerned. In this background, under WomenLift Health, we conducted this exploratory study on challenges of female oncologists in SAARC region, and we tried to find what are the challenges and what are the measures to be taken to improve the climate. The results suggested that women in managerial positions are much less than the men. What are the unique skills brought to the teams by women oncologists? It was found that they are able to do multitasking. They understand the human side better, as far as they are better communicators and effective management of the working team, despite they are less in leadership roles. What are the major perceived obstacles? So it is the finding a balance between work and family, barriers to travel to attend international meetings and other educational opportunities, and managing and organizing family commitments. Also, there is stereotyping wherein men perceived as natural leaders, while women perceived more as homemakers or supporters. How we can create a better world for women oncologists, and this is actually applicable to women in science at large. So there should be family friendly facilities at the workplace and congresses. There should be flexible educational or fellowship programs. There should be dedicated seats for women in committees till the time a real gender neutral environment can be established, and there should be better networking opportunities for women. There are similarities which were there from this current SAARC study as well as the old Indian study and the European study. In all these surveys, work-life balance is the major factor which was found as an obstacle. This study is really impactful. This is having a potentially practice-changing implications because we identified the critical lacunas in existing workplace structure in entire SAARC region in a large sample of 600 plus respondents, which are active oncologists and physicians, and they are male and female both. The respondents suggested solutions which are really practical. This is very much integrated into WomenLift Health journey roadmap. There are 4 pillars for leadership. There is authenticity involved. So when I conceptualize this study, this idea is very much close to my heart. I'm a proponent of workforce equity and equality and gender neutral environment. So this was right from the bottom of my heart when I conceptualized this concept. And after doing this pilot study in India, when we extended and expanded to SAARC region, we become more inclusive. And I'm proud to say that this is not only my voice, this is the voice of my peer from my region, my country, from SAARC region. And when we are collaborating to European group, other groups, it is essentially becoming global. So we are really inclusive as far as this project is concerned. Also, it helped me to challenge my thought process as well as my organization, Women for Oncology groups, to reevaluate the strategic vision we have while we are concentrating towards women gender in a center. And as any project's success is measured by the implementation has already been started because we are showing the objectivity, and the people will at policymakers level are getting gradually convinced. In Europe, there is some changes are already started making, and we are sure that this progress will soon percolate in this part of the world. So this will definitely help me in developing a more strategic leader and impactful leader. So I would like to acknowledge in the end that Women for Oncology groups for India, SAARC, ESMO, and a very special thanks to WomenLift Health. The left-hand side is the picture when we entered in this great program and we were neonates, and now in the right-hand side, it's 1 year plus when we have consolidated ourselves and become an infant. And I'm sure in the coming years, we will develop into adolescent and later young adult. And our voices, our work together can make a difference in this world. A journey of 1,000 miles begins with one step. We already have taken several steps, and I'm sure we will be going to succeed in this mission. Thank you very much.